Good afternoon. Welcome to Edenwald's virtual event, The Elephant in the Room, Senior Living in the Era of COVID-19. My name is Allie Watson-Fowler. I'm the marketing coordinator here at Edenwald, and I'm just going to go over a few guidelines for our webinar today. Firstly, just so everyone is aware, this webinar is being recorded, and that recording will be sent out to everyone who attended at a later date. You will notice that the chat feature has been disabled. If you have any questions, please direct those to the Q&A box, which you will find along the bottom of your screen. Our panelists will be answering as many questions as we can throughout the presentation, as well as after the presentation has concluded. And now I'll turn things over to our Director of Sales, Diane Stinchcomb.
Thank you, Allie, and thank you to our guests for attending today. I'd like to introduce you to the rest of our great marketing team. We have Debbie Janka, our marketing counselor.
Hello, welcome.
We have LaShawn Muhammad, who is our moving services specialist.
Hello.
If you would like further information after today's presentation, please give us a call or email us. My phone number and Debbie's numbers are at the bar under our picture. And again, we'll also have contact information on a slide at the end of the presentation. Now I'm going to turn things over to our special guest, Mrs. Kitty Allen, who is the president of the Edenwald Residents Association. Thanks, Kitty.
Well, welcome to Edenwald, if only virtually. I've been a resident here for 5.5 years and became president of the Residents Association on Friday, the 13th of March, when the pandemic hit. Ominous? Hardly. Since that date, life may have changed in some ways. But to a person, we residents have felt the friendly and loving care of the staff and the security of being a part of this wonderful community. Yes, we wear masks and stay socially distant from one another, but our activities continue. We've enjoyed dining under the stars all summer under the tent on the green roof garden. We celebrate happy hour in the halls with wine and snacks delivered. Our salon, library, pool, and fitness centers are open. Online links are provided to concerts, movies, classes, lectures, and church and synagogue services via in-house TV and YouTube. We select our meals from menus and have room service delivery for all 3 meals every day. This month, we've been holding flu shot clinics and have a table in the lobby where residents can bring their signed and sealed ballots, and Edenwald will deliver them to the official drop box in time for the election. Last Saturday, we enjoyed an artisans makers mart on the green roof, where more than a dozen resident craftsmen and artists, woodworkers, knitters, quilters, watercolorists, needlecrafters demonstrated, displayed, and sold the samples of their wares. People go out for walks and drives, safely temperature checked upon return. Personally, I feel so blessed that I am no longer alone in my former apartment, but I'm a part of the community that cares about and for me. And so are my children, who keep an eye on all things Edenwald via the website. I will be around later if you have any questions for me as a resident, for I could go on and on. However, it is now my pleasure to give our CEO, Mark Beggs, an opportunity to meet you. Thank you.
Thank you so much, Kitty. Am I broadcasting? You can hear me okay? All right, just double checking. Okay, usually my picture shows up in the corner. So anyway, welcome. I have a very short presentation just to kind of guide the discussion. I do want everybody to feel, even though you can't speak up, I do want you to feel like you can ask questions and interrupt throughout the presentation. I'm used to doing things in person. I've adjusted to the whole virtual event format, but I like to be engaged with people as I'm talking. So if I say something that is that leads a question, please put it in the box, and we'll interrupt the presentation to address that. Just general comments. We're open to everything. This is really a sharing. I came across the cartoon that's showing with the elephant on the psychologist's couch, and it just made me laugh because it really did speak to everything going on right now. I think if we think that we're not going to talk about a pandemic in senior living and nobody's going to know what's going on or think it's gone away, we'd be a little delusional about that. So we just thought it was just best to sort of talk about our experience, answer questions, give you a sense of what's been going on, not only at Edenwald, but probably a lot of senior living communities. I mean, I'm going to speak about us today because that's what I know best. I've been dealing with it since the start. But it is something that you, the stories out there give you the sense. I read an email today that sort of referenced the media sort of talking about senior living as a death pit. And that is so far from the truth. And I just think it's better just to talk about it and sort of reflect on what makes up senior living. Because a lot of the stories we see on the news, it's really about things that were occurring in nursing homes specifically. And of course, nursing homes have the frailest and sickest of the elderly in them. And quite honestly, I think what we've seen going on in nursing homes to me, doesn't speak to the nursing homes themselves, but more the national response to how to deal with the pandemic. All of us who work in senior living, we closed down here at Edenwald probably 10 days before most communities did, but things were changing every single day. What was happening, what the guidance was, there was a lack of personal protective equipment. There's just so many things that impacted what was going on in nursing homes. To blame those nursing homes for what happened it's completely unfair. But probably more importantly, senior living is not just nursing homes. Who makes up senior living? Nursing homes, about 1.5 million people living in nursing homes nationally. About 1 million people in assisted livings, HUD properties, which service a great number of seniors, 4.9 million, so almost 5 million people. Life plan communities like Edenwald, nationally about 745,000 people. So over 8.3 million people are living in some form of senior living. And then on top of that, you have adult day services, which is about 287,000 people. Home and community-based services, close to another 1 million. And then everybody who works in senior living, it's approximately 6 million people working in senior living. So 14.3 million, in addition to the other numbers that I mentioned, are all associated with senior living. So it's a tremendous number of people across the country. And it's just not nursing homes. And unfortunately, that's the only story anybody's hearing. So what's been the impact of COVID nationally? So these are current numbers as of this morning. Infections at 8.19 million people nationally, 220,000 deaths and growing by 59,000 new cases every single day. So we still are having a surge. I think the fall could be a tough winter for us, but when I say us, I mean as a nation, not necessarily as Edenwald. Maryland, infections at 136,000 and deaths a little over 4,000. 80% of all deaths have been with those 65 and older. So yeah, absolutely. Seniors are definitely being impacted by the virus, but it's not all that's going on. 41% of all deaths occurred in a long-term care facility. So less than half have occurred in long-term care. The rest of it's just been out in the community at large. And these numbers are from the Center for Medicare and Medicaid Services. So probably the most accurate tracking that's out there. Senior living specifically, and this looks at all types of campuses. Ziegler, which is a bond financing organization out of Chicago, they did a survey of CFOs, mostly in the not-for-profit sector, but probably lots of responded to it. And in their data, which is about a month old, 13.7 had no cases among staff or residents of COVID. 37.8 had a positive case, but 0 active. And then about 48.6% have currently at least 1 resident or staff person who has tested positive. Locally, and here at Edenwald, the graph on my right is Edenwald, but Baltimore County infections are almost 20,000. Deaths in Baltimore County, 653. In Maryland nursing homes, infections are at 15.4. And this is across the whole state, 15.4 thousand and a little over 2,100 deaths. Here at Edenwald, we've been very fortunate. Like I said, we closed down early, probably 10 days before most places were doing it. And we use the phrase lockdown, and I know that sounds like everybody is locked away in their apartments, but that's not really a good description of what it's been like here. But we did stop allowing people to enter the property. And as a result, we've been very fortunate. We've only had 2 residents of our 400 plus who have tested positive since the start of the pandemic, one in independent living, which happened really early on, early March, as a matter of fact. And then we had a resident in our assisted living who tested positive, who was asymptomatic the entire time. He would have never known if we weren't doing weekly testing here. And then from a staff perspective, we've only had 14 staff members test positive throughout the entire pandemic. None of that actually caused any type of outbreak. I will say the Department of Health defines an outbreak as one person testing positive. But in my mind, it's sort of, you see a group of people starting to get infected and become sick, and that just never really happened here. We've been solid and steady, and here we are coming up on 10 months of the pandemic. So we feel really good about our outcomes to date. We've done a lot of different things, and I will speak to a few of those. So what is the story? Like I said, you hear what's in the news, and we all know the news focuses on those stories that are sensational and will get you to tune in. You know, the daughter standing at a window with her hand on it, crying, trying to see her mother, you know, and that of course is heartbreaking for those of us who work in senior living. Or, you know, the nursing home that had, 100 cases. And there are going to be those sensational stories, but I think those are the unusual ones. They do seem like they make up the news because that's what they report. But it is certainly true that seniors are disproportionately impacted by the virus because of age and different conditions you have as you get older. It's just a natural part of life. Reporting and statistics are done predominantly on nursing homes. So you're not really seeing a whole lot of numbers related to the entire scope of senior living, but just what's occurring in nursing. So that gives you the impression that there's a bigger impact than there really is. And people equate senior living to nursing homes, and that's even before the pandemic. You know, everybody sees a retirement community and they think, oh, that's a nursing home over there, when really it's a minor nugget of what that campus offers. It's mostly independent living, people living vibrant, full lives with a tiny nursing home, but it's all equated as nursing home. And then even though there is a lot of data, nationally, the data collected has been very inconsistent. Even across assisted living. I think at this point, probably the nursing home data is the most widely reported. Assisted living would probably be next. Home care is not reporting at all. I'm not reporting from a senior living perspective, like on my independent living apartments. I report internally, but I don't report it out to anybody. So there's no data collection on what life plan communities are truly experiencing. And really, to me, the big story is just the lack of a national strategy to even address this. Testing and PPE, and there just has been no guidance whatsoever where communities like Edenwald have basically, despite the fact that none of us have ever dealt with a pandemic, have had to come up with our own strategies and just make it happen in the best way that we could, using guidance from the Department of Health and the Center for Medicare and Medicaid Services, which provides some guidance, but it's always sort of been in the rears. And as I said early on, it was changing every single day. We literally overnight had to change virtually every service that we deliver here on campus in a way that would meet the residents' needs and keep them not only healthy, but happy. So what's been our experience at Edenwald? Well, as I said, we closed 7 to 10 days before most organizations did. Just kind of saw what was going on, and we just thought, let's be cautious. Thank God for my healthcare team. We have a top-notch one here running our healthcare units, and they were watching and they got nervous really fast, so we moved quickly. We initiated training and observation on infection control procedures. We had fortunately just probably a month earlier had completely revamped our entire emergency preparedness plan, which goes over all types of emergencies, from a snowstorm to a fire to a hurricane, just virtually anything. So we were all prepped on what we needed to do. We closed up the community, started screening people who entered, staff and residents alike. We still do that to this day. We weren't allowing any non-essential people onto the campus. And I think as a result of all that quick action and thoroughness, we've been as good as we've been so far. And then really trying to take a look at how we serve residents in a way that keeps them safe, and putting that as our top priority. For example, we opened an in-house grocery store. We just did not feel it was safe for people to be going out to the grocers. So we, through our vendors, bought everything that people would generally need and get at a grocery store. We'd closed down our cafe and basically started a grocery store in-house and let people use their declining balance that they'd usually spend on food to buy their necessities that they needed, from toilet paper to shampoo to bread, eggs, whatever you would get at a grocery store. And we kept that open nearly 4 or 5 months. We provided food shopping via our in-house order through vendors. So every resident was given a shopping order form, and they could just check off what they needed: fruits, vegetables, lunch meat, what have you. And we would just buy it through our vendors and deliver it to their apartments. As Kitty already alluded, we provided fresh made meals 3 times a day to the apartments. I think in the market, we were the only organization that was doing that. Most places were providing several days worth of food on a day, and it was just in containers that they had to heat up. Well, most of ours, right from the beginning, 4 selections for each meal, everything made fresh, delivered to your apartment. We transitioned all of our lifestyle programming remote to online. Used an in-house channel, our YouTube channel. If you check it out, you'll see all sorts of exercise classes, my town hall meetings, everything's on there. Classes through Towson University, OLLI program, just all sorts of things that we made available online. And lots of communication, particularly early on. I was sending out communications on a daily basis, probably for the first 6 months of the pandemic, just sort of alerting to people to everything that we were doing, what our statistics looked like, answering questions. As we adjusted our operations, explaining all the details about that so people knew how housekeeping was occurring and how maintenance orders were being taken care of, and bus transportation, just everything. Every little detail that we had to change had to be explained on a daily basis. Provided conference line and video conferencing like this so residents could meet virtually. I will say not a whole lot of residents loved that idea initially, but I think it's sort of grown over time, just like us doing this virtual sales event. For a book club to meet over a conference line didn't seem as good as in person, but after a while, things just seem more normal, I guess. Created social opportunities, happy hours and celebrations out in the hallways, on balconies. We had a calendar of things that were going on usually twice a week at least, where we were taking out different types of snacks for people to be able to socialize. Did some things on our green roof. We had a violinist out on our green roof so that everyone in the apartments from their balconies could see the performance. We also initiated a lot of video conferencing, and we did that across all of our venues. I will share that I have a mom who's in a nursing home in rural Pennsylvania who I haven't seen since the start of the pandemic, and to me, the video conferencing has been a godsend. She's in a larger place than this, and I think it's a professional courtesy. I get to chat with her once a week. I think I'm the unusual person. They know what I do for a living, so I think they just go out of their way to keep me happy. But here we do almost 90 video chats per week, and we don't have 90 people in our healthcare right now. So some people get to chat with their families on a daily basis. If all they need is set up and can do it on their own, they're doing it. And we've made all of that happen. So clinically, we were very intentional right from the get-go about how to handle the pandemic. It wasn't only that the residents might get sick, but so might the staff and their families. Childcare issues were happening, and schools were closing, and what if the staff couldn't show up? and how are we going to handle that? So we made it a very intentional strategy to really freeze where people were living, let those in independence stay there with whatever support was needed. We stopped transitioning people into higher levels of care, healthcare and assisted living, not only to make sure that we weren't spreading a virus from the independent into other settings, which was of course a fear that we had, but also if we started to lose staff, how are we going to manage that? So using this strategy right now, our healthcare and our assisted living is still full, but our healthcare is at 50% occupancy. And as a result, as our staffing levels have fluctuated, we have been able to be completely staffed with high staffing ratios, which is something Edenwald is known for. And we have not had to worry throughout the entire pandemic. We have been fully staffed here. Our lower numbers allowed us to have fewer staff, so we lost some people via attrition, as you would normally expect. Some people just decided that this was just too much and I don't want to be in senior living right now. So as those people left, we were still fully staffed and able to maintain our ratios and give the care that we're known for giving. It allowed us to limit opportunities for the virus to be brought into the community. And it allowed us to be more intentional. We have done a tremendous amount of education and supervision over infection control. We do daily rounds. We monitor everyone wearing their masks and the gloves and the PPE. They're questioned on the different aspects of infection control. So as a result, we have been extremely solid here. And I will say, even just as an aside from the pandemic, it wouldn't be unusual for people to have flu and go out to the hospital throughout the entire year. This year we've had virtually nothing happening because people are masked and just being safer than they would normally. So as a result, we've had, I think, exceptional outcomes throughout the pandemic, and we feel very good about what's going on here at Edenwald. I think I already reflected that since the start of the pandemic, we've only had 2 residents who've tested positive, 14 staff people with no additional community impact, meaning through our screening process, we identify these people, we send them home before they have any signs or symptoms. So there was never any exposure risk from these 14 people on our campus. So as a result, we've been very good. Lots of organizations are struggling financially as a result of the pandemic. I was on a conference call probably about 3 weeks ago, and they did a survey of over 300,000 not-for-profits, and 22,000 of them anticipated having to close as a result of the pandemic. I hear the number 22,000 and you just cringe because you think of all the people that are being served by organizations across this country that are not for profit, that all they really do is serve people out in the community. But it was odd that you hear that number and that they were actually happy about this because it was less than 10%. But still there's 22,000 people, 22,000 organizations that may stop serving probably hundreds and hundreds of thousands of people. We've been very fortunate through the pandemic because of our strategies that we're actually having one of our best years financially. We aggressively managed expenses right from the get-go to counter everything going on with COVID. We did apply for the payroll protection plan money and got $2.6 million that helps bridge any losses that we might be experiencing. Our occupancy has stayed extremely strong throughout the whole pandemic. We're currently sitting at 93% in independent living, which is approximately where we started the year. We've increased our days cash on hand, which is every day we have a certain dollar amount that we spend, payroll, supplies, bills, everything. And since the start of the pandemic, and if you take that daily amount, if I stopped taking money from every single payer today, no resident ever gave me another penny, how many days could Edenwald survive with the money that we have in the bank? We started the pandemic at 529 days and it's grown to 574 days. So we're actually increasing our days cash on hand. Our investment portfolio took a beating at the start of the pandemic, but right now we're close to within $2 million of the start of the pandemic. So we're actually doing extraordinarily well. And we ended the year really high. So we're actually doing very good. And all of our bonds that we do our financing from are rated through an organization called Fitch, and we've been affirmed as BBB stable. So despite the pandemic, where a lot of organizations are having their bonds downgraded, ours have been solid and we have not had any type of issue. So as a result, Edenwald is really just planning for the future. I got to the point about a month ago where I decided I was tired of talking about COVID all day, every single day. It was my entire life. And I needed to focus on something else. So in talking with the board, we've decided we were going to move forward. The future is ahead of us, not behind us. So we started renovating. Since we closed the dining rooms, most of the meals are being done as room deliveries, as apartment deliveries, but we do have our green roof open. So we closed the grill in the Valley room, and we decided since it's closed, let's just renovate it. So that's underway now. I hope to complete that by December. We're also going to renovate the dining room in our assisted living Southerly place. So that'll be starting shortly. With our occupancy down in some of our healthcare areas, we decided to upgrade some of the rooms so that they looked a little bit more modern. So we've been upgrading those. Our Medicare certification, that was something we actually hoped to get at the start of 2020, but because of the pandemic, they stopped doing surveys for Medicare certification. So that kind of put us on hold. We did submit our application earlier this month. So now we're just waiting for the surveyors to show up there. They are doing these surveys. So with any luck, we'll have our Medicare certification by the end of the calendar year. We also decided we were going to start rolling out some of the technology that we had planned for this year. Connected Living, which is a portal for the residents for communication and know what's going on campus. We've got that rolled out, and we also contracted with something called Embodied Labs. It's a virtual training program I was really excited about. I saw it at a conference last year, and it allows us to better train our people that work in memory care and across other medical conditions, but mostly for the memory care units. It allows people to truly experience what it is to live with dementia. And it's such a powerful program. I think it's going to be a real game changer for the staff and the services that we offer here at Edenwald when they really have a real understanding of what it truly is like to live with dementia. When I did this example at the conference, it ruined a whole day of my life because I was just so emotionally impacted by it. It was that powerful. And then finally, strategic planning. We have a very good strategic planning committee through the board. Kitty is a member of that. And we've decided we need to continue planning for our future. And two things that we are going to be moving forward on is a continuing care at home program where contract residents will just stay where they are. Not everyone wants to move into a retirement community. And this would be an option for people to get the protections and be part of Edenwald without actually moving here and just being able to be at home. And then we are going to build a second campus, and that's something that we're very serious about. We have a partner, I can't go into all the details, but we do expect to open a second campus probably by 2025. So we're going to really be working towards that. And I think that is my final slide. So I'm going to turn it back over to Ali and Diane, and then if there's questions, we're certainly here to have conversation.
Thanks, Mark. So we'd love to hear your questions. If you go to either the bottom of your screen or the top, depending on what technology you're using, you'll see a little box that says Q&A and a little bubble. You can type a question in there. If you would prefer to ask us a question, you can click on the little waving hand on the bottom of the screen, or again at the top of the screen, and then we'll unmute you. We won't see you, just your name that you have entered in for the Zoom would come up again, but not your picture. So again, we look forward to seeing questions that you might have. And here is our first question. Our first question is, and this is a question for Mark, what is the advantage to Edenwald of Medicare certification?
Well, there are so many advantages. We are the only life plan community in the state of Maryland that doesn't have its Medicare certification. I have no idea why previous leadership would have thought that that was a great idea, but in my opinion, it just isn't. People join a life plan community with the promise that they are going to get whatever care that they need from the time they move here until their last day. And without our Medicare certification, I don't feel that we have the ability to fulfill that promise. People need to be able to use their Medicare benefits. You can get care here without using it, but that is, you've paid into Medicare your entire life. Why wouldn't you want to take advantage of that? And then from the rest of the residents' perspective, it's also an additional revenue stream. So it helps defray daily payment for Medicare could be $500 to $600 a day for skilled nursing care. It helps defray overall community costs. We have extremely high staffing ratios in nursing care. I think it gives us an opportunity to pay for some of those costs without the residents having to foot the bill for it in the same way. So those are my main reasons why thinking it just helps us be more financially stable as an organization and really fulfill the promises we've made to residents.
Okay, we have two questions, Mark, about the new location. Someone asking where the new location might be located, and then if it would be in the, and then specifically if it would be in the Towson area.
I almost hesitate to share too much information about what we're planning. I would expect it to be very local, and it most likely will be in partnership with a college. Let me just say that. So it's likely to be on one of the local colleges.
Thanks, Mark. We have a question from Marty. Marty asked, as the weather becomes colder, what area will be used instead of the green roof for gatherings and concerts?
Well, I guess my hope is that we're going to start doing more things indoors. We've actually been having discussions about that. Our intent, my intent was actually to start opening up the community for outside visits when we started opening up for healthcare. We're mandated right now by the Center for Medicare and Medicaid Services to allow indoor visitation in our skilled nursing areas, our healthcare units. So at that time, I thought I would open up all of the rest of the campus. But given the surge that's going on nationally, infection rates are up 30%. I think we're still looking very good here in Maryland. But with that said, we had a meeting with the Resident Association Executive Committee, and in discussing it with them, we felt it just was premature to start opening, particularly with the weather being nice outside. So we decided to just monitor it. So we're going to be watching it really week to week about opening up for visitation. And when we do that, we'll also start opening up some of the other venues. So we'll probably close our green roof, our Dining Under the Stars program, could be by the end of the week, depending on how the weather's looking. And then we are going to open up our cafe where we'll be able to socially distance and have meals inside for approximately 36 people. And then with any luck, the grill in the Valley Room renovation will be done in December. We'll be able to do probably close to 40 in each of those venues. So we'll be able to serve meals for 120 people inside safely. And I would see us, if we have those spaces available and we can do meals, why couldn't we do other types of programming in that space, socially distanced? So that would be our intent, is just start to use our indoor spaces to offer more and more. And again, we monitor every single day what's going on campus. If we had any type of surge, we would shut things down. Like I said, here it is, the end of October, and we've had virtually nothing happening inside the campus. And God bless every single resident who lives here. They give me a lot of credit, but honestly, it's a team effort. I can't keep people safe if they're not willing to be safe. And fortunately, they get it, and they've done very well. And we continue to open things up and offer more amenities because of what they're doing. So.
Thanks, Mark. I think you brought up a good point, which there's a few questions that we have, one from Judy and one from Cynthia, just asking about how can we be sure that when residents are leaving the campus to visit family and friends, that they're not bringing in the virus. And then asking about residents going off campus for doctor's appointments. And since you already talked about that a little bit, Mark, I'm going to ask Kitty, if you don't mind, just sort of talking about what you and some of your friends here do as far as like how careful you're being, maybe talk about telemed.
People come and go to doctor's appointments. They go out to have lunch where people have outside dining. When they come back, their temperature is taken. If people are gone for the weekend, depends on where they've been and who they've been with. And it's up to our resident counselor whether or not they have to go into quarantine or if they just have to avoid eating with groups of people here. It's all kind of individually based, but people are feeling free to come and go and do what they want to do, but they always know they have a safe place to come back.
Yeah, I mean, we have a tool that we started using early on for people that wanted to go away on vacation or to visit the family. And it identifies all the risk areas that they might encounter, makes them think, okay, am I going to be going out to restaurants? Am I going to be in a group of 20 people? Am I going to be using utensils? You know, it sort of makes you think through how to keep yourself safe. Our goal here isn't to tell people they can't do something. Our goal is to make sure that they understand what the risks are and what actions they can do to keep themselves safe. And I think our experience is saying that the residents get it. I already said that. They know what to do. They're not going to take an unusual risk. I would say, and as a result, we've been good. I will say when the stay-at-home order was lifted and I saw some families show up, they concerned me at times. I sent out some communications directly to families to address that. I would watch and I would see my residents out there all masked and everything, and their families are all standing around, not wearing anything. And it's like, God, do I run out there and yell at all of them? And it's like, well, no, they're adults. It's not my job to yell at people. It's my job to make sure that they understand the information and what to do. And since that time, it has gotten incredibly better, and I have no worries at this point. So.
Thanks, Mark. Allie
That's not to say I don't worry. I'm a worrier. But I have no worries. So, yeah.
Thank you. Allie has someone who's been very patiently waiting with a raised hand that I couldn't see. So I believe her name is Candy. Allie, do you want to unmute her so we can get her question?
Candy, are you ready?
I am ready. I have a couple of questions for Mark. So you mentioned that the occupancy rate was 93% for independent living, and that hadn't changed. So are you saying that there were no departures of residents for because of the COVID, going back to their families or wherever they went?
We had a few people that chose to go stay with their families, but it was probably three tops. But those apartments are still occupied from our perspective because it's their intent to return. So the 93% would include anybody who may have done that.
Okay, and
so, but we haven't had other people move out or transition in any way. No.
Right, that's a pretty low number. So,
Mm-hmm.
You mentioned about the Medicare certification. So you've never had Medicare certification?
Not here at Edenwald, no. No, people could still come and get skilled service, but it would be a room and board charge. And actually from an expense standpoint, like if they needed medications, they would pay for that privately. If they had therapy, that would be billed to their Medicare Part B. Medical supplies would be paid for privately. So that's the other big benefit and an important one for me to ignore. During a Medicare stay, 100% of your services are covered by Medicare as long as you have skilled care. So if you are receiving therapy or have wound care or getting IVs, then Medicare would pay for your stay here. So so things that you are being charged for privately.
Days, right.
Yeah.
Yeah, for a limited amount of days. But and could you explain a little bit more about your thinking that you didn't externally report the number of positive infections or deaths in independent living, since the strategies were applied to both independent living and to the long-term care residents, and they're living in the same facility. I was just wondering, and they
Yeah,
can come and go. So what was that thinking about?
It really wasn't my thinking, to be honest. It was the Department of Health has a requirement about who is reporting, and licensing agencies are requiring reporting for various things. So the website that, like, if you go to Maryland.gov and do the COVID site, you will see reporting on nursing homes and assisted livings. So for independent living, aside from the Department of Aging, which we're licensed by, there's nobody that really inspects it or regulates it. So nobody's asking for the information. So there's nowhere for me to report it to. So nobody's really, so I guess that's more the answer. It's not that I had a strategy that I wasn't going to tell people. It's that nobody's asking for it. So I'll tell anybody who asks.
Yeah.
Well, Mark, you have communicated that to us internally.
Oh yeah, it goes out. The chart that I showed during the presentation, that's part of a weekly communication that goes out to every resident and family member that gets an email from us. So everybody has access to that information.
And we also post that on our website as well when we get the communication from Mark. So he's being extremely transparent with both people inside the building and outside of the building. So I'm just looking through the questions. It looks like we have several questions about Medicare. I'll kind of go back to that, but one of the questions asked was how frequently are the residents and staff tested for COVID? So right now we're testing all of the assisted living, memory care, nursing care staff on a weekly, residents on a weekly basis, as well as
Not the residents, not the residents right now.
anymore? I'm sorry.
Yeah, no, right now,
Staff.
we would only test residents if we had a positive case. So right now we have no positive cases, and that means a positive case with a resident or a staff person. So if I had a staff person test positive, then we would test everybody in healthcare and assisted living from a resident perspective, and then every staff person who goes into healthcare or assisted living. So right now, the only people being tested weekly are the staff because they're coming and going. And we haven't had a positive test in 4 to 6 weeks. So that's one of the reasons we're opening for visitation. So that's how the testing is being handled at this time. We have the ability to actually go to monthly testing. We could have started that already, but I didn't think it made sense to open healthcare and assisted living up to indoor visitation and move to monthly testing. I just felt like if I was going to have more exposure opportunities, it made more sense to continue the testing level where we were. So once we start doing the indoor tests, the indoor visitations, and our weekly testing looks good, then it's possible we might go to monthly testing if the positivity rate locally stays where it's at.
Thanks, Mark. We have a question about whether our suites in nursing, are they private or are they semi-private?
Everything is set up as a private room, both for assisted living and healthcare. We have enough licenses where some of them could be semi-private, but that's not the expectation here at Edenwald. So we keep it private, and that's our intention and our goal. I always think about myself, would I want to share a room with somebody? And the answer is no.
No.
So if I wouldn't do it, I wouldn't ask anybody else to do it. So.
Thanks. We have a question from Dottie about getting information on continuing care at home, but I don't know that we have any current information that we could provide for that, correct?
No, we really don't. We're in the planning process. We did a call with the Department of Aging. I probably did that 3 weeks ago to talk through the process. We've been doing calls out to other organizations nationally that do this to help us do our plan. We're going to bring in a consultant to help with our market study. We have to have an actuarial study done. Our strategic planning committee is meeting. We've had 3 meetings so far about continuing care at home. So as it all comes together, one of the things that we will do is do focus groups. So just be on the lookout for that. We'll probably look to people that are in our database and on our wait list as part of the focus group. where we'll be discussing it, because the idea, it would be an entrance fee product. You would stay in your home, you pay a monthly service fee for certain types of support to keep you at home. It'd be greatly reduced probably from what you would pay to come into Edenwald itself. But the way the package would look would depend on what the market study tells us people are looking for. So we would be building it through the market research.
Thanks. And then the other question, part of that question was whether or not Medicare would cover that. And I don't believe it would cover continuing care at home, correct?
It wouldn't, yes and no. It wouldn't, the continuing care at home is sort of in supplement to Medicare. So Medicare would still cover things like
rehab,
Medicare home care visits, rehab visits, as Diane just said, to your house. If you broke your hip and you needed to go into a nursing home, hopefully it would be the one here if you were one of our continuing care residents, Medicare would pay for that. What the benefit package would do would provide additional supports for you in your home.
So there, we have a question about what we're doing for individuals who have seasonal affective disorder, which I think just kind of goes along with all of the programming that we're offering. Kitty, would you want to talk about some of the programs that we're offering now that we can't have, now that we're not doing things in the same way we were prior to COVID?
Well, I'm not quite so sure how that affects the question that they asked, though. I mean,
maybe I could address that a little bit. Just because one of the things we've had to look throughout the entire pandemic is really the mental health and well-being of all the residents on campus. I recently did, and it hasn't been published yet, an interview with the Baltimore Sun about this very thing. And actually one of our residents on Independent also, I offered him up and he interviewed, because he's an independent, his wife's in healthcare, and just the emotional impact of the entire thing. So I don't even think it's just necessarily the seasonal affective disorder, but it's just the stress and trauma of being away from your family. So we have a relationship with an organization called Counterpoint. They provide mental health services, and we have engaged them across the entire campus. So we identify people who are having issues, and we get them hooked up with that service. And it's both medication management and also psychological services and counseling. They have social workers and what have you. So we're really trying to be on top of that. In addition, just to add, with the stay-at-home order, we had a big concern here that people who are usually extremely active out and about in the community and in the gym and just in the pool, and and now they're not allowed. With the stay-at-home order, aside from walking around, they weren't able to have the same type of physical activity. So we reached out to our rehab provider, Assisted Rehab, and they started screening our independent residents and providing Part B therapy and also guidance to our wellness manager, Ryan, who's amazing. You can see him on our YouTube channel, Eden Senior Living. Check out his videos. He's really great. He was able to develop some programs for people as well, just to keep them active and engaged so that they weren't declining because of the stay-at-home order. Watching and trying to help everybody if we can.
So it looks like we have time for about one more question. Do we have any other questions? Okay, we have a question from Judy about when do we expect outside visitation to begin?
Good question. Well, outside visitation is occurring. So let me do two answers on that. So residents have been going out throughout really the entire pandemic, except during the stay-at-home order. There was still a little bit on the sly. People can visit outside. We have lots of spaces for that to happen. Allowing outsiders into the community, I see us doing it probably, Kitty, I'm still thinking probably early November, because I think the weather's going to start to get cooler.
Right.
As long as there's not a major spike in Maryland, part of my hesitation was that the reporting on 30% increase nationally, And I've been watching Maryland. It's gone up a little, but it still tends to be pretty flat. And I think as long as people are local, I've already sort of developed the criteria and how we would manage it. I mean, we'd have to manage the number of people coming onto campus. They would show up screened. They would have to wear a mask. We would screen them. They would go directly to an apartment and they would visit the apartment and then they would directly leave. So we sort of have what we would do. I just really want to know, it's more, when I suggested we were going to open, every communication I had from residents was don't do that. We're safe, leave it the way it is. So that's what I went with. Kitty had the same response. And I won't say it was like an overwhelming, but the only people that said anything was don't do it. So we are gonna do it, but I want to make sure that people are comfortable that we're doing it, because their biggest fear is that they're doing everything they can to be safe and somehow somebody carelessly is going to make them sick. And so we have to be just cautious about that. So I think November. I think it's going to be in November.
So we have one more question. Donna has raised her hand. We do have other questions that we don't have time to get to all of them, but again, please reach out to us directly. 410-823-1349 is the number to the marketing department. And then we can always put you in touch with Mark for specific questions, or even Kitty has volunteered to answer questions and help residents in their search for senior living. So again, I'm sorry we can't get to all the questions, but we'll open it up to Donna again, who raised her hand. Donna?
This is actually Dan. Can you hear me?
Oh, hi, Dan.
Actually, yeah, I was just following up on the question we had asked previously. I wasn't sure if you were going to circle back regarding the now with Medicare certification and hopefully with now Medicare covering costs they apparently didn't cover before for nursing home care. My question was simply whether anyone thought that maybe the entrance fees would change.
At this point, I do a market study and I personally handle it because I like to see my competition, know exactly what's going on with them. Our entrance fees at this point are still on the lower end of the market. So for like this upcoming year for 2020, we're not going to touch entrance fees at all. We're going to keep them flat. I don't think the Medicare certification necessarily has a whole lot to do with the entrance fees amount. That's more of a day-to-day operational expense. I will say, I think the Medicare certification is going to help us keep our monthly service fees lower as we go forward, or do smaller increases. Because at this point, and not to get too complicated, but in a type A community like this, people don't pay for the services they really get on the healthcare side. You're locked in on the apartment style. And when you go to into nursing care, it costs $13,000 a month to provide nursing care in a nursing home. Most residents here are paying a small fraction of that under a type A contract, even when they go into healthcare. So the nursing home is actually a loss leader for us. We just lose a fortune on it. So the Medicare is just going to defray that expense and allow the monthly service fees to be more, I don't say more reasonable, because our monthly service fees are extremely reasonable. We're actually at the bottom of the market. But the Medicare certification will help us manage the monthly service fees going forward.
Thank you.
And let me just add, we actually have a board meeting tonight, and we'll hopefully get approval on the 2020 budget. And even with the pandemic going on, we were able to put together a budget. And I'm telling you, our expenses are through the roof here. We had to budget for $760,000 next year just for testing, COVID testing alone. Our occupancy being down. I go into a whole lot of factors, but we still were able to put together a budget with a 3% increase. So we're really proud of being able to manage that, given everything going on. So.
Thank you.
Mm-hmm. Yes.
Thanks, Dan. Well, thanks everyone for joining us. On behalf of Mark, Kitty, LaShawn, Debbie, Allie, and myself, we really appreciate you joining us, and we hope that we will hear from you soon. So thanks again.
Yes, thank you for attending.
Thank you. Bye.
Bye.
Bye.